Because you have access to this neural tissue.
All right, good afternoon, everyone, or good evening, depending on where you are. Welcome to the third session of our Future MDs in STEM summer program. We're incredibly excited to have you all with us. This is our last session for our first week, and then we're going to be picking up again next week. So just a couple of things before we get started. Again, live closed captioning is on. We're live streaming to our YouTube channel in case you get kicked out of Zoom or you can't join back, or if your internet connection is unstable, you're more than welcome to join there as well. We also have some additions to our regular itinerary today that you might have seen in Slack. So our research symposium prompt has been released. And so later on in the session, Alex is going to be going over, the research symposium prompt and perhaps answering any questions that you have. He's one of our co-directors of research here. We have our workshop today, and we also have our guest speaker. So unfortunately, because our guest speaker isn't here yet, what we're going to do is actually start with our workshop for today. And then once our guest speaker gets here, we'll transition into our guest speaker segment. So we're just flipping the order a little bit today. So first, we're going to start off with our workshop, which is on medical practices and surgical techniques. I believe it should be in the drive, but if it isn't, please let me know. I'm going to be presenting as well as Sajid. Sajid, if you'd like to introduce yourself, you're more than welcome to. We're going to be splitting the presentation, and Sajid is one of our executive interns.
Hi, everyone. So I'm Sajid, and I'll be helping Davina present the workshop.
Awesome. Thanks, Sajid. Akil, did you have a question before we got started?
Yes, I just wanted to let you know that it is not in the Google Drive for session 3.
Okay, perfect. So sorry about that. And what I'll do right now is I'll just put it in the drive quickly, and then we can go ahead and get started. If you have any questions so far, you're more than welcome to ask them in the chat or ask them anywhere else. But if you don't have any questions, then we will still go ahead and get started with our workshop. If you'd also like to take some time now to maybe open up the research symposium document, you can. It's in the Google Drive. So if you click on the Google Drive and then click on research symposium, it's going to be there. So if you'd like to open that up and perhaps give it a quick read through before Alex goes over it after the workshop today, you're more than welcome to. But if you'd just like to, follow along for right now and, pay attention to the workshop, you're more than welcome to that, whichever one works better for you. Okay, I'm putting the link in the chat now, so if you'd like to open it, you're all more than welcome to. If you want to take notes or annotate it, it should be accessible to everyone to at least view and download. So I'll give everyone a second to kind of get everything in there, and then we'll go ahead and get started. Also, just a quick reminder that we don't have a session next Monday because I know that today's Canada Day and then Monday is the 4th of July. So what we're going to do is we're giving everyone a bit of a longer weekend. So we don't have a session on Monday. So our next session, or session 4, is going to be next Wednesday. So if you are thinking of joining Zoom on Monday, you can, but there won't be a session, so you don't have to. We might be hosting some office hours, but our next official session is going to be next Wednesday. Okay, so welcome everyone to our medical specialties and surgical procedures workshop. Okay, so we're going to briefly talk about a sample timeline on applying to medical school or applying to perhaps a DO school, MD school, something like that, and what it might look like for your undergrad career, what it might look like post-undergrad, etc. So first we have undergrad, which is going to take you about 4 years, or it could take you some more depending on what program you're in. I know that for some students, they might take a gap year, so undergrad might end up being a little bit longer, or they might take a 5th or a 6th year, or they might take some time off between high school and undergrad. So 4 years plus, there's a plus after that because it could definitely be over 4 years. But generally, we see the majority of undergrad careers being at least 4 years. So you're taking your pre-med courses if you're planning on applying to med school. A lot of the pre-med prereqs are bio, calc, physics. Some schools in the US require orgo. I don't know if all the medical schools in Canada require orgo or organic chemistry. And then, perhaps a semester of English, a semester of psych or sociology or humanities class. So you don't have to major in something that is like just core biology or physics or English to apply to medical school, but you do have to be taking some of the prereqs. It shouldn't overwhelm your schedule depending on what you're majoring in, but you do have to take some of these classes in order to apply. And then here's where we have a 2 to 10 year gap. So in this gap after undergrad, you could be going to grad school, taking a gap year, doing an S&P program, studying for an MCAT, taking your MCAT, doing some shadowing, researching, working, starting a family. So there's a lot that can go on in this year. It's also becoming more normalized to not just go into medical school straight away after you're done with your undergrad. So some people have been taking more time. And it's more popular now to just take more time between undergrad and medical school to just do some other things. But perhaps after that, you apply, you've taken your MCAT, you're working on your application, getting interviews. And then after that 2 to 10 year gap, perhaps you go to medical school and you spend 4 years, in tons of different rotations, working with surgical teams, attendings, etc. And then after that, you spend about 4 to 8 years in residency. So this is where you can learn to specialize. So there are over 135 specialties and subspecialties to choose from. So after medical school, you could choose to specialize maybe in pediatrics. So pediatrics is 4 years. And then maybe you could further choose to subspecialize in neonatal and perinatal medicine, which is another 3 years. So it's the 4 years for pediatrics plus another 3 years, or maybe you could do pediatric cardiology, or maybe you could do neurology and then further specialize in diseases, etc. So it's not a requirement for you to subspecialize, but if it's something you're interested in, there are always a lot of options open. So that's why 135 might seem like a very high number for the amount of specialties there are, but it's not just specialties, it's also including all of these subspecialties. So is becoming a doctor the only way that you can make an impact in medicine or healthcare? And of course, the answer is no. You could become a scientific researcher where you conduct trials or experiments for various fields. Perhaps you are testing a new drug or you're running clinical trials to see if patients that have this disease experience a better quality of life if they take this treatment or if they take this other treatment, etc. Or you could become a physician's assistant where you still get to examine, diagnose, and you treat patients, and you can work in a couple of different fields of medicine, and that's still a great option. Or you could perhaps be a genetic counselor. So genetic counselors usually advise families that have perhaps children or loved ones with genetic conditions, and they kind of just make sure that they inform them on, how genetic conditions might affect families, etc. Okay, so now we'll have kind of a little race. So we're going to ask a question, and the answer to the question is a field in medicine. So if you'd like to kind of answer with the field in medicine once you know what it is in the chat, more than welcome to do so. Okay, so the first one is that this is a specialty that pertains to the nervous system. Professionals diagnose and treat conditions and disorders involving the brain, the spinal cord, peripheral nerve, muscles, autonomic nervous system, blood vessels, etc. I'm going to see it in the chat. Perfect. Yes, I think EDT said it first, but yes, neurology is correct. And we also talked about this at our last workshop as well. So great job, everyone. Alrighty. So the next one, or we'll talk about neurology first, and then we'll go into our next little race. But again, we talked about neurology at our last workshop as well. It's just a specialty that is referring to, specialists that kind of diagnose and work with patients that have diseases or conditions involving their brain, spinal cord, etc. There are also some subspecialties that you can get involved with. And these are some subspecialties that people don't really often know about, because they know that they can go to residency for 4 years for neurology to become a neurologist, but then they don't actually know about these subspecialties. If you remember Becky from our first session, she's a child neurologist. So she specialized in neurology, and then she subspecialized in pediatric neurology. You could also do brain injury medicine, clinical neurophysiology, pain medicine, sleep medicine, or perhaps you could subspecialize in neurodevelopmental disabilities. So there are a lot of options for you after you specialize. Okay, the next little race. So specialists in these fields work with patients that have perhaps conditions or diseases of the respiratory tract, immune system. So that could be asthma, food and drug allergies, or perhaps even immune deficiencies. I'll check in the chat. Yes, so I think.
I may be using the time now.
Time now, like
Past 10, and I'll come back tomorrow.
yeah.
Okay, one sec.
Yeah.
Yes, so I think everyone's getting it right. Yes, allergy and immunology. I'm seeing a lot of immunology in the chat. Someone asks if these specialties are the same for nurses too. And for that question, I'm not 100% sure. I know that if you become a nurse practitioner, one of the many fields that you can pursue in nursing, you get more autonomy over your patients and you can choose what you want to specialize in. So one of our guest speakers from last year, her name was Mayura. She's a nurse practitioner and she's a pediatric NP. So she chose to specialize in pediatric nursing. So I think some of the specialties are the same for nurses, but perhaps maybe not all of them. I know you can also be an ICU nurse or a trauma nurse, etc. So there might be some overlap, but I don't know if they're exactly identical. And I don't think the process is the same either. But again, there might be some overlap there as well. So someone else asked if this is mainly for nurses. So what we're talking about right now is medical school, but if you are planning on applying to nursing school, this information is definitely helpful as well because it is kind of talking about a lot of fields that overlap with nurses as well. And keep in mind that if and when you are working as a medical doctor or you're in medical school, you're not just going to be working with only medical students or only doctors. You're going to be working with the whole team at the hospital, which includes radiologists and volunteers and nurses and all different kinds of people that are working there. So it's not that just this does or it doesn't mainly pertain to nurses, but we're just talking about what you would be pursuing as an MD, but you might be able to work with other people as well. Someone else is asking if med students are required to subspecialize along with the main specialization. You do not, and Sajid said this as well, you do not have to subspecialize. It's an option for you if there's something that you kind of want to dig deeper in. So like Becky was mentioning, she really loved neurology, but she wanted to focus on the child side of it because that was what was really interesting to her and how kids tend to, you know, bounce back a lot quicker. And that's what she really wanted to study. So if you're passionate about it, you can of course choose to subspecialize, but it's not really a requirement. Going to residency in most cases is a requirement, like she was talking about as well, but it's not the only thing that you have to do. So yes, to everyone that was saying allergy and immunology, you're all correct. So specialists in these fields, they work with patients that have, you know, allergies or diseases of the respiratory tract or immune system. So good job, everyone. The next one is, so specialists in these fields, they help care for patients so before, during, and after surgery, basically via sedation. And I'll check in the chat to see what everyone's saying. Perfect, yes. I think Sarai, you said anesthesiology first, so great job. Everyone's getting this correct, great job everyone. Yes, anesthesiology. So anesthesiologists, they help care for patients before, during, and after surgery by kind of sedating them. So they put them to sleep before surgery and ensure that they stay asleep. So I know that sometimes there's kind of a stigma around anesthesiology and that it might not be as hard as other medical professions, but also please keep in mind that anesthesiologists are responsible for tons of different patients in tons of different surgical procedures. So the amount of medication or, you know, treatment that they administer depends on the kind of surgery, the patient's body weight, any pre-existing conditions, and they have to closely monitor the patient throughout the entire surgery process to make sure that their vitals are okay. And if they're not, they have to make some changes, etc. So anesthesiology is definitely still a very tough field, and you can still even within anesthesiology subspecialize. So you can go into critical care medicine, hospice, and palliative care, and pain medicine. Does anyone know what palliative care is? You can answer in the chat, or you can raise your hand. Either one works. Okay, I'm reading the chat, and yes, everyone's getting it right. So kind of end of life care, conditions without cure, care for people that are near death, end of life care. Exactly. Yes. So that's what palliative care is. Good job. All right, so healthcare professionals in these fields, or this field in particular, they kind of treat adults and perhaps infants and children who have conditions, diseases, disorders involving skin, hair, and nails. So this also includes things like skin cancer, tumors, diseases, and they can also perform superficial procedures on the skin. I'll check in the chat. I think Laylee said dermatology first, so great job. And lots of people are saying dermatology as well. Great job, everyone. So dermatologists treat adults and pediatric patients with these disorders. And even within dermatology, again, you can subspecialize in a couple of things. So we're showing you some of the most popular subspecialties. But again, like we mentioned in the beginning, there are over 135. And unfortunately, we don't have enough time to go through all of them. But we're showing you a lot of the subspecialties that you can go into. There are still more. So this isn't an exhaustive list, but it is pretty comprehensive. So you can go into dermatopathology. Does anyone know what pathology is? Or what the pathology is kind of the study or the science of. So check in the chat. It's the science of diseases. Perfect. Good job, everyone. So we have pediatric dermatology, dermatopathology, procedural dermatology, and there are a couple more, I think. All right, so the next one involves a healthcare profession where these doctors are required to diagnose patients through things like maybe x-rays, ultrasounds, MRI techniques, sound waves, etc. I'll check in the chat, give everyone a second to get their answers in. Yes, I think Desmond said radiology, so great job, everyone. I'm seeing it a lot there as well. Diagnostic radiology, radiology, perfect. Everyone's getting this right. So in diagnostic radiology, again, they're diagnosing and seeing what could be happening in patients through x-rays, sound waves, ultrasounds. So like we mentioned earlier, radiologists usually work with other specialties. So for example, if you are going in to an MRI because you've been experiencing seizures, or they might want to be checking if there's a tumor, a radiologist will be kind of helping run your MRI, but they're going to be working with your neurologists and neurology attendings and perhaps other professionals on the scene to cross-reference with them and see what might actually be going on. So radiologists don't necessarily work alone, not that anyone in the medical profession necessarily works exactly by themselves, but there's a lot of consulting and cross-checking that goes on. Again, see, there are a ton of subspecialties, and does anyone know why there might be a lot of subspecialties for radiology and not just, you know, one field of radiology being able to perform perhaps everything for everyone without giving me the answer too directly? Does anyone know why there might be a lot of subspecialties? Yes, perfect. Everyone's getting this right. The human body is definitely complicated. What we were looking for more so was multiple types of diseases and a lot of organs to image and different kinds of medical imaging techniques. So we have MRI, CTs, X-rays, ultrasounds. There are tons of different kinds of imaging procedures. You can have EEGs, ECGs. We went through some of the different testing types yesterday. So it would be very beneficial to subspecialize, because since there are so many different kinds of imaging techniques, it would be better to have subspecialties where they can get really comfortable with, perhaps, if they're in neuroradiology, they might want to be really comfortable with MRIs and CT scans and work with the neurology attending. So there are just a lot of places where diseases can occur, or conditions, like someone said in the chat, and also just a lot of different kinds of medical imaging techniques. So it might be overwhelming to put that all into 4 years of radiology residency, which is why they provide these subspecialties. All right, so our next one involves a field where these professionals provide care for adult and pediatric patients in emergency situations. So maybe they're working with direct EMTs. They assist patients once they arrive at the emergency department and perform a more comprehensive analysis. So not EMTs themselves. Yeah, perfect. Everyone's saying emergency medicine. I think Nicholas said that first. Great job. And I'm seeing it a lot in the chat as well. Someone's saying that to further subspecialize, you must go farther into residency. Yes, that's correct. So you can go through residency first to regularly specialize. And then if you want to subspecialize, you do have to go through further education and further testing. So great job, everyone. I think everyone in the chat did say emergency medicine. Again, we're assisting patients in emergency situations once they arrive at our department. Are we the ones, let's say we're emergency medical doctors, are we the ones performing the first primary analysis of the patients? Are we the ones that are arriving first on the scene? No, exactly. Everyone's saying no. Do you know who might be performing that first analysis, or a team, or just who might be doing it first if we're not doing it? Exactly. EMTs, first responders, emergency nurses, paramedics. Exactly. Everyone's getting it right. So even though we're not performing the primary analysis or the primary checkup, we are the ones that once they arrive in our care, we're the ones performing the secondary ones and performing more critical treatments. Again, there are a couple of subspecialties that you can go into, like pain medicine, pediatric emergency medicine, sports medicine, internal medicine, etc. All right, so for this next specialty, so physicians in this one, they treat diseases, disorders, conditions involving your heart, blood, kidneys, joints, your digestive system, your respiratory system, your vasculatory system. So basically all of your major organs, and it's mostly for adolescents, adults, and elderly patients. We don't see this as much for infants and children, so not as much for pediatric patients. And generally, physicians in this field are providing long-term care, perhaps maybe disease prevention, wellness, substance abuse, mental health issues, etc. Yes, so a lot of people in the chat are saying internal medicine. Exactly. Great job, everyone. That's what it is. I can definitely understand why you might think it was cardiology, especially since going back, the first two kind of diseases that these specialists will be working with involve, heart and blood, but we're also talking about kidneys and a lot of the major organs of the body. So not just cardiology, it involves a lot of the other major systems of the body as well. So that's why we are specialized in internal medicine. So they're providing, again, long-term care. Some subspecialties include maybe advanced heart failure and transplant cardiology, cardiovascular disease, critical care medicine, hematology, nephrology or oncology, etc. All right, so physicians that treat hereditary disorders and diseases, perhaps by addressing or diagnosing genetic defects, they can also serve as consultants to patients for their families. What kind of specialty or what specialty is this? Yes, I'm seeing this a lot. Medical geneticists. So, great job, everyone. All right, so the correct response was medical geneticists, and a lot of you said geneticists or medical geneticists, so great job. Again, they're just providing consultations for patients and their families. Perhaps patients come in with their families and their families have questions or concerns about genetic conditions. Perhaps they want to know if they're carriers for certain diseases or anything like that. So that's why this is an important field, because we want to figure out what might be hereditary and what might not be. So some subspecialties in this field include biochemical genetics, clinical cytogenetics, clinical genetics, and maybe even molecular genetic pathology. All right, so specialists in what field might use radioactive materials to diagnose and treat diseases including hyperthyroidism, thyroid cancer, tumors, bone cancer, etc. This one's a bit trickier. Trying to think of a hint I can give. Perhaps focus on what your thyroid gland is, what body system your thyroid gland is really a major part of, like your thyroid gland, your pituitary gland, hypothalamus. I'll give everyone a second because this is definitely one of the trickier ones. Yes, and also keyword using radioactive materials. Okay, I'm waiting on a few more responses and then we'll go through. I'm trying to read through everyone's, and I'm seeing a lot of endocrinology, radiology, radio-oncology, oncology, pulmonology, oncology, endocrinology, nuclear medicine, pathology. So there's definitely a wide variety of responses here. So this one's actually nuclear medicine. So if the radioactive materials portion of what the hint was saying here was taken out, it could definitely be endocrinology. Again, the endocrine system was what I was trying to get at, because your endocrine system does involve hypothyroidism, thyroid cancer, etc. But again, keyword radioactive materials. This one was definitely a bit trickier, so I apologize about that. But this is actually nuclear medicine because they're using radioactive materials, and endocrinologists don't necessarily use those materials themselves, but they might work with nuclear medical doctors. So they're treating and diagnosing diseases, including some of the stuff that we talked about before. All right, so another medical specialty involves caring for associated disorders of the reproductive system for females and also other individuals. They can take care of pregnant individuals, provide gynecologic care, oncology care, surgery care, and private personal healthcare and primary healthcare as well. Check in the chat. Okay, perfect. Seeing a lot of gynecology, OBGYNs, gynecology, gynecologists. I'm scrolling back up and reading some of your responses about not knowing that nuclear medicine was actually a field. Me neither. That wasn't something that I learned about until very, very recently. So again, please don't worry if you didn't know about nuclear medicine before. It's not a field that's actually as well talked about, or has a lot of, not that they don't have a lot of professionals in the field, but it's just something that isn't as popularized, especially when you think of doctors. You might think of pediatricians, family doctors, internal medicine, emergency medicine. Nuclear medicine usually isn't the first thing that comes to mind, but we wanted to introduce you to some other fields that might not be as common, but are still just as important. Moving on to this one, everyone's saying OBGYN, obstetrics, gynecology, OB and gynecology. Perfect, perfect. Someone asks, I thought it was just a major and the field being radiology. No, so this is actually something that you can go into residency for separate to radiology. Radiologists are not necessarily working with nuclear or radioactive materials. They're working with other kinds of scans and techniques, but it is separate from radiology, which again is not something that a lot of people tend to know about. So great job, everyone. Everyone's saying that it's obstetrics and gynecology. You're all correct. They're treating and caring for individuals that might be pregnant, need gynecologic care, oncology care, primary health care. And there are a couple of different subspecialties that you can go into from here, like female pelvic medicine, maternal fetal medicine, neonatal medicine, etc. All right, so if you have any questions, again, be sure to keep putting them in the chat or raise your hand, but now let Sajid take over.
Okay. I don't have the slides.
I can scroll through for you if you'd like.
Oh, okay. Okay. Okay, so the next specialty we're going to talk about is ophthalmology. And so ophthalmology is basically medical and surgical care of the eyes and related vision problems. So some subspecialties that fall under ophthalmology are anterior segment / cornea ophthalmology. So the cornea is the first layer of the eye where the light comes through, and then you have glaucoma ophthalmology. Glaucoma is basically a disease where you have intraocular pressure inside your eye, and that can hinder your vision. So that's what that specialty deals with. And then you have neuro-ophthalmology, because you have the optic nerve go inside your brain, so it deals with that. And then you have ocular oncology. You can have eye cancer, where sometimes you'll have to take out your eye through surgery. And yeah, next slide, please. Next slide, pathology. So that's basically the study of disease and the nature of diseases specifically. So pathologists can run clinical lab tests, examine tissues, cells, body fluids, and they can also examine fetal tissue. So some subspecialties may be anatomical pathology, transfusion medicine, chemical pathology, clinical pathology, and forensic pathology, where they may analyze samples from a crime scene. And then you have hematology, that's related with blood, immunopathology, and then neuropathology, where you're dealing with brain disorders. Okay, next slide. Pediatrics, okay. So pediatricians work with patients from infancy to adolescence and can diagnose childhood diseases. So pediatricians basically work with children, and some subspecialties are adolescent medicine, so teenagers basically, and child abuse pediatrics, pediatric cardiology, pediatric endocrinology, and basically all the specialties there are that exist because children, the body has different body systems, right? So basically, it's every body system, but for a child. So that's why there's several subspecialties with pediatrics. And then you have physical medicine and rehabilitation. So basically, these are physicians that help patients with disabilities, that deal with the brain, spinal cord, nerves, etc. And what's unique about this medical specialty is that they work to improve patient quality of life. So they don't necessarily look for cures, because sometimes there aren't cures for disabilities because they're usually chronic. So what they'll try to do is they'll improve patient's life, and they'll do a lot of rehab to make sure that the patient can return to what their previous life may have been like or close to it. So some subspecialties include brain injury medicine. So maybe in a car accident, you may have brain trauma. So rehab would be necessary to regain control of your brain. And then you have hospice and palliative medicine. So this is patients that are terminally ill. Usually they'll have six months to 1 year left, and they will need a diagnosis from a doctor saying that they have 6 months to usually 1 year left, and they can be admitted to a hospice, and they can receive care there. And then you have neuromuscular medicine, and then you have pain medicine. Next slide. Preventive medicine. So preventive medicine works in fields such as clinical medicine, biostatistics, epidemiology, environmental and occupational medicine, and health services management. The goal of this professional is to help aid the community in preventing diseases. So you may not, so when you go to the doctors, I mean, you may not always have a condition, but the best way to not have a specific condition, especially as you're growing older, you may have joint problems, arthritis, and the best way to not have this is to prevent it And that's why you have, oh my gosh, what is that called? Oh, colonoscopy. That's why when you, I believe the age is 45 or could be 40, I'm not sure. But that's why you have to take routine tests like a colonoscopy to make sure you don't develop diseases like colon cancer. Some subspecialties are aerospace medicine, medical toxicology, occupational medicine, and public health medicine. And someone in the chat is saying, what is epidemiology? And someone says a study of epidemics. Yes. So, COVID, well, that's a pandemic, but it pretty much falls under epidemiology. That would be epidemiology, where you examine epidemics. Yes. Psychiatry. Okay, so psychiatry is when so it says psychiatrists devote their careers to mental health and connections between genetics, emotion, mental illness, and can conduct medical and psychological tests to diagnose patients. So you're probably wondering what's the difference between a psychiatrist and a psychologist. I think that's a really common question people wonder about. So psychiatry is a specialty and you would need to go to medical school. So a psychiatrist is a type of doctor, whereas a psychologist isn't necessarily a type of doctor because you don't need to go to medical school for that, but you do need to go to a specialized school for that. But there's similar things, except a psychiatrist can prescribe medicine. Okay, so subspecialty. So you have addiction psychiatry, drug addiction, substance abuse, and then you have administrative psychiatry, community psychiatry, emergency psychiatry, military psychiatry, so maybe PTSD, when, if you are in the military, you may have seen things that have traumatized you, so that's what military psychiatry would be for. And then you have child and adolescent psychiatry. So someone is asking about, in the chat, about aerospace medicine. Okay, so I'm not too sure about that. Maybe Divina knows a little bit more about aerospace medicine.
Yeah, so a little part of aerospace medicine, something that you may or may not have learned about in school, is that when astronauts are going into space, they have to do a lot of training, especially since gravitational forces are different and your body is used to something because of all the time that you've spent on Earth. And if you are exiting Earth's orbital field and you're encountering new gravitational forces, it might impact your body. So aerospace medical doctors might be working directly with astronauts to make sure that their vitals are still okay while they're outside of Earth, and making sure that everything's okay there, maybe administering treatments, medications, activities that astronauts can be doing. I know that there are a lot of videos online about what a day in the life of an astronaut is like, and they still have to exercise on treadmills to make sure that they're getting their walking in so that their muscles don't deteriorate, because if you go a long time without using your muscles might again deteriorate. So that's kind of what aerospace medical doctors work on. There's definitely more that they do, but they're just trying to make sure that people that exit Earth's field are still doing okay.
So next is surgery. So surgeons can choose to become general surgeons or specialize in a specific area of the body, type of patient, or type of surgery. So surgery is very broad, and so there are many types of subspecialties. So there you have colon and rectal surgery, you have general surgery, you have gynecologic surgery, plastic surgery, oral surgery. And if you would scroll down, I think there's one more. There's more. Okay, so there's otology, pediatric surgery, and even within pediatric surgery, you have neonatal, newborns, prenatal, and trauma. And then lastly, thoracic surgery, and there's more. So basically every part of the body you can have a subspecialty for. It's really broad, and there's also orthopedic surgery. So there's a lot. Okay, next slide. So we are done with specialties and we are moving into common procedures in medicine. Okay, next slide. Phlebotomy. Okay, so phlebotomy, if you know your word parts, you'll know that phlebo means vein and tomy means incision. Okay, incision. So the procedure is basically when a needle is used to take blood from a vein, usually for laboratory testing. And there are preferred veins where you would want to stick the needle in. You have medical, cephalic, and basilic. So phlebotomists can draw a CBC, which shows WBC. Okay. Oh, so CBC would be a complete blood count, and then a WBC would be your white blood count. And your white blood count can show if you have an infection. So when you go to the doctors, they might draw your blood and they'll show you your different quantities of your blood cells, and that can determine, and it'll be sent to the lab, and a pathologist, specifically a hematologist, can examine your blood and can tell which diseases you might have. So in this picture, phlebotomy. Okay, so the needle should form a 15 to 30 degree angle with the surface of the arm and swiftly insert the needle through the skin and into the lumen of the vein. So in this image, you can see that right here, the needle, it's at a 15 to 30 degree angle and it's going into the skin. And there's different, you can insert this into different layers of the skin. And after you do that, you have to put it inside a container to avoid cross-contamination. Next slide. Okay, so in the chat, Davina is asking why you would prefer veins over arteries. So does anyone know? Okay, so someone's saying maybe damaging an artery can be fatal. Okay. Someone else is saying veins carry blood towards the heart because arteries bring blood away from the body instead of towards the body. Blood pressure. Thinner walls in veins. Yes. More pressure in arteries. So yes, these can all be reasons why the preference is made. Okay, so appendectomy. So a surgeon makes one incision. So this is a description of the procedure. So as you may know, an appendectomy is when your appendix ruptures and you need to have your appendix removed or excised, which is what ectomy means, in case you were wondering. And then a surgeon makes one incision in the lower right side of your abdomen. So that's where your appendix is located. And your appendix is removed and the wound is closed with stitches. So as you probably know, you can live without your appendix. Your appendix isn't totally useless. Recent research has showed that it stores good bacteria, which may be useful for your body, but you can still live without it. So there's that. So, okay. So the first step in the procedure is the surgeon makes an incision in the lower right section of the abdomen, right? So that's where your appendix is located. And the incision is less than 3 inches in length, because the appendix isn't that big, to get it out. And then number 2 would be the surgeon conducts an internal examination of the patient. And during this step, all the organs in the abdomen are identified and checked for disease or abnormalities, just to make sure that nothing else needs to be done while there. Because what happens is a lot of the time when you go in for a procedure, they might find a cancer or a tumor there. And that's why you'll hear a lot of stories of people saying, oh, I went in for the doctor for this, and they found that I had a tumor and they caught it early and that saved their life. So that's where these types of stories come in. Okay, next slide. Step 3. So once this has been completed, the appendix is located and brought up to the surface of the body. So the appendix is removed. It is separated from the surrounding tissue and the cecum. So that's part of your large intestine, and then removed from the body. So your appendix is attached to the cecum, and so it is detached and removed. The last step, I believe this is the last step, yes. After the appendix has been removed, the cecum is closed and returned to the abdomen. So we basically just make sure there's no, because the appendix is attached to the cecum, so they just seal it. The cecum is closed and returned to the abdomen, and then the muscles are sewn back together, and finally the skin is sewn together. So that's just suturing. Thoracotomy. Okay. So the description for this surgical procedure is when there's a cut made between the ribs. So thoraco refers to your thorax, and that's your chest, right? And that's made between the ribs, and that's to reach the lungs or other organs in the chest or thorax. And typically, a thoracotomy is performed on the right or left side of the chest, where your lung and your or your heart or your lung is. The procedure is done when taking out part or all of a lung or abnormal growth is developed on a lung. So if you have cancer or some type of hyperplasia, then you might need a thoracotomy to be done. So another reason is reinflating collapsed lung. So if your lung collapse, then it needs to be returned back to normal, reinflated. So that may be another reason to make an incision in your chest region. Okay. And then taking out a blood clot, tumor, or lymph node, if you have cancer or if you have a clot, thrombosis, or whatever it may be, a thoracotomy may be necessary. Repairing your heart, removing the cyst in your chest, repairing your diaphragm that allows you to breathe, and then removing part of your chest wall. Next slide. That's just the thoracotomy. They're basically cutting into your chest to repair that region. So the procedure overview takes around 3 to 4 hours, and the surgeon will just cut into your chest. So it's around 6 inches long, and it's just below the tip of your shoulder blade. Okay, continued. Once the surgeon has reached the desired ribs, they will cut further until they have enough room to work. And once finished, the surgeon will put in tubes, one which will drain fluid or air that may build up inside our chest, and another will let your medical team give you medicine. So they will put tubes inside you, and it efficiently drains out any excess fluid or air that you may have. Also lets you intake the medicine directly inside your body. Okay, so I'll speed things up. So I think our guest speaker is almost here. Okay, so incubation. So this is when a tube is placed inside the mouth and it helps you breathe. And when does someone need to be intubated? Airway obstruction, cardiac arrest, injury or trauma to your neck. So basically anytime that's urgent, you will need an intubation where you can't breathe or you need help breathing. Okay, next slide. So this is an intubation, endotracheal. So the tube goes inside your trachea and that helps you breathe. Free skin graft. So skin grafting, it's pretty self-explanatory. It's when they take a tissue from another part of your body to repair a wound or a lesion on a separate part of your body. And then these grafts obtained are placed in a new area, right? And these grafts are called free because they're taken separately from distant part of the body. And they're usually taken from your buttocks or your thigh region where there's a lot of excess skin. Oh, and there's a question. So does anyone know which medical instrument is used to take a skin graft? And you may put that in the chat if you know. Yeah. It's a pretty tricky question. I don't know if anyone knows. It's not a common instrument. It starts with a D if anyone needs a hint. Yes, someone says something tome. Yes. Yes, it's a dermatome. Yes. Dermatome. That is specifically used to take a graft. Yes. Okay, next slide. That's where the answer is. Yes, so the answer is a dermatome. Dermatome, and you can see in the image, dermatome basically takes a slice of your skin. Okay, next slide. MRI. So you all know, we've all heard of an MRI. So it stands for a magnetic resonance imaging. So the imager uses radio waves and strong magnets to create a view of your bones, tissue, and organs. So MRI scans are ideal for getting a detailed, in-depth look at your tissues or organs. So keep this in mind because the next slide is about a CT scan, and then we'll compare and contrast what an MRI is versus a CT scan. Okay, so usages of an MRI: tumors, breast cancer, joint abnormalities. These are all could be possible usages of an MRI. Okay, next slide. And CT scan. So CT scan is stands for computed tomography, and it can also be referred to as CAT scan. And CAT scans are basically X-rays, or CT scans are use X-rays to create multiple cross sections of your body. So if you want to compare contrast, CT scans use radiation while MRIs do not. CT scans are quick and non-invasive and are preferred in emergency situations. And some usages of CT scan include circulation problems, lung issues, and etc. Next slide. So can you spot the difference between an MRI scan and a CT scan? And you can include your answer in the chat if you want. And there's no one answer I'm looking for. It's just whatever you see. So someone's saying you can see muscle in the MRI scan. Isn't an MRI scan more detailed? It can be. And then on the CT, the organs are also viewed. Yes, usually yes. MRIs focus more towards bones. Yeah, so these are all great answers. Okay, next slide. And that's pretty much it. I'll let Davina take over.
All right, perfect. Thank you so much, Sajid. Again, everyone, we do apologize. Dr. Whittaker, our OBGYN guest speaker for today, she was held up on a case, but she's still going to be here today in about maybe 5 or 10 minutes. So again, thank you so much for being patient with us as we make some of these changes. So right now, what we're going to do is actually have Alex, who's our co-director of research, take us through the research symposium prompt. We're going to have some time for you to answer questions, and then we're going to go into our guest speaking portion. We can ask Dr. Whittaker any of your questions about medical school, becoming an OBGYN. She's also subspecialized within obstetrics and gynecology. So if you have any questions about subspecialization and you want to hear from someone that has actually done it today, you're more than welcome to do so. But again, we do apologize. She was held up on a case at her hospital and was doing some charting, but she's still going to join us today. But otherwise, I'll let Alex take it away, and I'm going to send the research symposium doc in the chat and we can get started. And just one last thing, we've been getting a lot of questions about, is the research symposium mandatory, and do I have to do it in groups, or can I do it individually? So to answer the first question, it's not mandatory. It's definitely preferred if you could at least try to perhaps maybe work on it a little bit, work on it in groups, because it's a great way to collaborate with some people that you might not be working with in any other settings, especially since the summer program is only a couple of weeks. And for the second question, so last year we did require that you work in groups. This year, it's not a set requirement, but we would really prefer it if you worked in groups, because that's kind of one of the points of the program, is to create a really nice collaborative space for everyone to be here and to be able to, work together and, work on a project together, especially since you might not be seeing these people in school or in any other academic settings. So we really would strongly prefer it if you worked in a group, and we're going to do everything that we can to help you find group members. But again, it's not a set requirement. It's just very much strongly preferred. And for all of our previous submissions that we've seen for the projects, a lot of our, top awarded presentations have been group submissions. Not that you need to be in a group in order to do well, but being in a collaborative space is definitely helpful. It won't impact your ability to get a mentor or anything, but again, we would prefer it if you worked in groups. But if you're not comfortable with that, you can, of course, work alone. But I'll let Alex take it away.
Yeah, hi everyone. Hope everyone's Friday is going really well. Again, I'm Alex. I'm one of the co-directors of research at MedStem Powered. And yeah, today I'm going to be going over the research symposium doc, which again, Davina will send out and you will have access to, which you can refer to in the future. So I'm going to go ahead and share my screen. Let me see here. Okay, let me see. Can you guys see the, okay, cool, awesome. So this is the research symposium document, and this contains all of the information that you need to know for the research symposium. And again, you will have access to this throughout the summer, so you don't have to feel pressured to take notes right now or anything like that. You will always have this to refer to when you need to. So on this document, you'll see that we have a full page of background information. And for this summer, the research symposium is going to be based around the topic of climate change. And climate change is obviously a very pressing issue. But just as a little recap, climate change refers to the ways in which our natural environment has been changing, mainly due to human activities. And since the 1800s, climate change has primarily taken the form of global warming, where average temperatures across the planet have been rising, mainly due, again, to human activities. So we're going to be looking at this topic, but since this is MedStem Powered and this is a medical organization, we're going to be looking at climate change's consequences on human health. So for example, in this paragraph, you see some examples of these consequences, so such as droughts affecting ability to grow food and increased air pollution. So we're going to be looking at all these different effects, and that's what this research symposium is focused on. So if you go to the second page of the research symposium document, you'll see the actual details for the project. And the prompt is basically, again, you're going to be looking at the various consequences that climate change has had on human health and medicine as a whole. And it is your job to devise a solution that will address some of these complications, as well as, mitigate them and deal with them. So your solution can take the form of a biomedical device, an engineering device, or it can even be something like a public health policy or a legal policy. So you guys have the free range of motion, or not of motion, but the freedom to kind of design whatever solution works best for you. So feel free to be creative with that. And under this section called details to consider, you'll be given more information on what specific consequences on human health climate change has. This section kind of elaborates on these different effects. So for example, this paragraph talks about air pollution and goes into depth about that. This paragraph talks about increased amount of allergens. So you have a lot of information to work with here to choose which kind of effects you want to deal with. And you can look at this section for basic information about that. So go to this page. This page starts the requirements, so the actual requirements for your project and your submission. And this first one says that solutions must aim to address and mitigate at least 1 to 2 of the effects of climate change on human health. And so again, you want to be looking at 1 or 2 of the consequences on human health that climate change has. You can refer to that details section again for background information, and you want to tailor your solution to addressing and helping to mitigate 1 or 2 of these effects. Obviously, you can go broader. That's why we do say at least 1 to 2, but addressing all the effects may be challenging. Obviously, climate change is a very broad issue. So just for your sake and for the sake of your research, limiting your focus to maybe 1 or 2 of these effects will probably be best. So that is just what we recommend. The next requirement is that solutions have to have a specific problem statement or statement of need. So this goes back to the first requirement where you really want to be focusing on a very specific effect so that you can provide a specific problem statement or a statement of why you need this solution that you're designing. And you'll see that in these sub bullet points right here that I'm highlighting now, these are kinds of different questions that you can think about answering when you are creating your final submission so that you can make sure that you do meet this requirement that is bolded at the top. So for example, you should probably be thinking about, what specific effect on human health will you tackle and what are the ways in which you're going to go about solving it in your project. So just thinking about how to answer these questions is going to help you meet that specific requirement. And also an important side note, obviously climate change again is a well-known issue. And so there's a lot of existing research and existing solutions that have been posed to tackle various health issues. And so feel free to dive into the existing research on this topic. In fact, that's probably what you want to do to support your arguments, which we'll talk about later. But remember that you can't really just use an existing solution. You can't just and there has to be some unique aspect to it, and you will be partially judged on how unique your solution is and how novel it is. So just remember that if you are basing your solution and your project on something that might be already existing, just make sure that there is a sort of unique aspect to it and that you're building upon what is already there. And the third requirement, and probably the biggest requirement, is solutions must be justified by having scientific data. So what makes this a research project is that everything you state, everything you have on your final submission has to be justified by some sort of scientific evidence and some sort of scientific data. So for example, when you are explaining what your solution is and how your solution will help address your chosen health effects, make sure that you have arguments made that are backed up by scientific evidence. And that is obviously the biggest part of this. Make sure that everything that you state, especially things that aren't your own ideas, are not only cited, but also backed up by specific credible evidence. And again, these sub bullet points here provide a couple of different questions that you can use to guide your thinking to help meet this requirement. So for example, you can talk about what are the kinds of possible tests and trials that can be used to test your solution for its effectiveness if you were to actually carry it out in the real world, and what kinds of data, quantitative and qualitative, will you be looking for to help demonstrate that your solution is actually effective. So again, main takeaway from this requirement is just please use scientific data and evidence to back up everything that you have on your submission. One of the last ones is you want to also address the pros and cons of your project, just looking at your project from many different angles. And so, for example, how would you go about designing your project? What are the pros and cons of your solution? How does it actually work? Things of that nature would probably be good things to address on your final submission. And you can also consider things like ethical and social challenges. That would be great as well. Just really thinking about your solution from many different avenues and making sure that you're exploring and being thorough with the information that you provide surrounding your solution. A couple last things. Make sure that you have a minimum of 5 reputable scientific sources again. And by reputable, we mean sources that you find from credible places. So things like PubMed, online scientific databases, online scientific journals. All of these things would be pretty credible places because these are places where you can find scientific articles that have been reviewed by other actual scientists in the field. And again, we don't want to have solution or sources that are found from random places on the internet. Just making sure that they are from places that are verified and credible. And again, all sources must be cited in MLA format on your poster. And lastly, it says here that this project must be completed in groups. We really do encourage you to work in groups. A big part of research is working with others. So we really do want you guys to think about maybe working in groups, and you guys have Slack and other platforms at your disposal to help form these groups. But again, don't feel pressured. Don't feel like not having a group or not being able to form a group is going to make or break your project. It's really not. But we really do encourage it. And if you do want to have a group, but you're finding it hard to form one over Slack or over a different platform, feel free to message me or feel free to message any of the other team at Medicine Empowered, and we'll definitely help form a group if you still want some that way. So yeah, but just don't feel pressured. That's not a really strict requirement. We do encourage it, but what's more important is you participating in the research. And a couple of last things here in terms of submissions. This submit here will be updated with a link for a form where you can actually submit your project. So that's going to be updated in the coming days. So be on the lookout for that. Your submissions are due Friday, July 29th at 12 p.m. Eastern time. And your submissions, your projects can take many different forms. So for example, it can be in the form of a slideshow, a pre-recorded video, a document that has all the information surrounding your project, or any other visuals or graphics. Or if you can think of other more creative ways to present your project, that's totally fine as well. Just make sure that you email this email for approval before you actually dive into creating your final submission. But just remember, this will be updated with a link that will lead you to a form where you can submit your project by Friday, July 29th at 12 p.m. Eastern. And then also we encourage you guys to present your submissions live during the actual research symposium event that will take place on Saturday, July 30th at 9 a.m. Eastern time. And so again, we really encourage you to take your projects, present them live in front of other Medicine Power members. But an important thing to note is that with limited time, we might not be able to view all submissions live. But if that happens to be the case, there will be an option for you to pre-record your presentation and upload it to a shared platform where everyone can view it that way. So you will have the option to present your submission live either way. And we really do encourage that as well. This bottom part is just information on when the research symposium is actually taking place and the agenda for that day. And again, there will be awards that will be given out for projects. These awards are not only for the project itself, but also the speaking components. So there will be some awards for the groups that choose to present live. So be on the lookout for that as well. Okay. But that is this whole document. Again, you guys have access to this document, so you can always refer to this throughout the summer, and the rubric that will be released in the coming days or the coming weeks. So just also be on the lookout for that. You will have access to that as well. But I will go and look at the chat to see if there's any questions that haven't been answered yet. Feel free to put all of your questions in the chat. So one of the questions is, do you have to present live to be considered for an award? Okay, Davina just answered it, but I'll answer it again. So for speaking awards, yes, you have to be there to present live, but there are awards that are just based on your project itself, not the presentation component. So either way, you will be considered for an award. Yeah. And again, if anyone has any questions besides or outside of this meeting, feel free to message me on Slack. I'm active on there, or message any of the other team members at Medicine Empowered, and we'll be happy to answer your questions there too. So yeah. And I'll hand it over to Davina.
Awesome. Thank you so much, Alex. And again, you can message Alex if you have any questions. The document's going to be there throughout the entire summer. We're going to be uploading other student submissions, just basically anything that we can provide you with to help you succeed. But again, you can message Alex, you can message any of us, and we'd be more than happy to help you out. I've answered all the questions that I've seen in the chat, but if there are more, maybe Alex, you could stick around to maybe answer some of them, or perhaps just be active on Slack like you mentioned earlier. But otherwise, thank you again, Alex, for going through the research symposium. We hope you're all excited. This is a really cool topic, and we're really excited to see all the solutions that you all come up with. Every year, we're always very, very impressed at the creativity that you all put in to the projects and all of the hard work. So I'm sure that this year won't be any different. But if you have any questions, again, you're more than welcome to reach out to us. But otherwise, we'll let Dr. Naomi take over. She's here from the hospital, and we'll get started on her guest speaking portion. Again, if you have any questions for Dr. Naomi, you can put them in the chat, or raise your hand or do something else. But we'll let her take it away.
Hi, how are you guys? I'm sorry I was late. In the middle of surgery, it took longer than I expected. I'm going to be driving, so Davina, could you read questions maybe?
Yeah, of course, no worries.
At times, if that's okay?
Yeah, of course.
So where do you want me to start? What would be helpful for you?
Maybe you could talk about maybe your journey into medicine, some tips that you have, and then we'll open it up to questions that people have for you as maybe an OBGYN or as just someone working in the medical field.
Sure. So I wanted to be a physician since I was a kid. My parents are immigrants, and they just told me to dream big. I didn't have anyone medical in the family whatsoever, or even really know much about navigating schools or anything here. So I just worked really hard, and I'm not naturally very good at test taking. I'm a very normal person, just a very hard worker. And I think that's what helped get me here. So that's one thing to amazing test takers. So let's see, where do I go next? With college, I got maybe one B a semester. I majored in neurobiology, which I loved. You don't have to do biology. It's actually kind of the worst one to be in for med school because that's what everyone wants. Everyone is in biology that wants to go to med school. You really shine, just that I noticed, when you kind of did something unique like English, but I don't like English. So that was my thing. And if you love it, you're going to do better in it. So do what you love, because that's your one time, to really delve into that thing that you love and enjoy it. Plus you'll shine, and then you'll have a backup for something if you don't make it into med school. So I didn't do well in my MCAT either. I had a lot of anxiety before, and tornadoes came through, and we lost power. So I didn't do great. I got just good enough to get in, I guess. And I applied to 10 medical schools and got into Creighton. And so that's where I ended up going to school. You shine there. I really liked Creighton because they looked at the whole person as an applicant. If I looked at something online and it showed me how to get, and so that really appealed to me, that school. And I thought, I'll probably have a better shot there than my state school. I was in Indiana at the time. And one thing I think that helped me with that school is that they tend to look at the whole person, not just the numbers of the MCAT. And so I did a ton of extracurriculars, lots of leadership roles in undergrad. And volunteer work. I, volunteered in the ER just doing charts, like really boring, simple stuff. But it was nice to just get my, feet wet in the medical field. And I think that really helped. It's shown that I'm a well-rounded person. And I think just being a normal person, being able to talk to people, they want to see that someone is going to be able to connect with patients and communicate with patients in an effective way. So I think a lot of medicine is important, like communication and being able to connect with people. So it's important not to lose that when you're studying and in undergrad, and make sure to have a good time and do things that you love, and that will show as well. What was the next question?
Okay, so someone asks in the chat, what specific extracurriculars or leadership activities did you do, and what really interested you in becoming an OBGYN?
Oh, okay. What did I do for my extracurriculars?
Yeah.
Is that the question? Oh, I mean, it doesn't matter really what you do. I did like student government. My gosh, I did ROTC for a little bit. I started a few organizations. Did like this outreach project, volunteer stuff. Just really, it doesn't matter what specifically you do. I think it just shows that you have initiative in what you do. So if you're going to do an organization, make it count. You know, you don't want to just show up one day and put it on your resume. You want to try to be a leader of the organization if possible, like a vice president or president. And so that's what I did. And if I didn't like an organization, I just made one that I liked. And that's what I did. Yeah, like student government is fun. I thought maybe that would look good. I enjoyed that. But so again, it's just what you love. I mean, I did some stuff with my husband. We got married in undergrad, and he was in a Homeland Security fraternity. So I helped him with that and got a leadership role. And if they don't have a leadership role for you, maybe they can make one up for you. Ask them. Can I be the director of, I don't know, community events? Like that's what I did for student government. I was the director of like some kind of like philanthropy or volunteering. So you can often make up roles or make up organizations and make it happen. I mean, obviously not fake, but to actually, that's what college is for, to take initiative and explore your passions if that organization doesn't exist or if it's not what you want it to be and you can't get a leadership role in that organization. As far as OBGYN, well, I thought that was the last field of medicine I would pursue. I thought I wanted to be like a family medicine doctor or endocrinology or peds endocrinology. You know, you don't really know until you are in medical school and you get to be in the classes and then get to shadow or be next to those doctors on the floor in the hospital and see what they actually do day to day. Because theoretically, I love neuroscience. I studied it in undergrad. But in reality, it was not my thing whatsoever. So same thing with OBGYN. I thought it was just pap smears and STDs, and I thought that sounded really boring. So when in medical school, I found out about this specialty that I do of fertility in a restorative way called naprotechnology. And I had these subspecialists at Creighton, and I was able to shadow them and see the cool things they do. And then I learned about it, and even on a personal level. So I just found out about that in med school, my first or second year. I first found out about it. I still didn't know what I wanted to be until third year, and that's really when you decide what you want to be. So you don't have to worry about it too much, because third year is when you go through and get to experience all the different specialties, and that's when you realize I am surgical, I'm not surgical, you know, I like clinic, or I like, you know, working with kids all day, or I don't like having kids cry all the time, whatever it is. You get to see what the day-to-day is like, and you'll fall in love with something. There's so many different fields of medicine, and they're so different, you know, radiology versus pathology. They're more introverts tend to go to those versus, I don't know, you know, surgical where you're hands-on all the time.
Okay, so the next question was from someone asking what a typical day looks like for you.
Well, I don't have a typical day necessarily. I do one 24-hour shift a week because I joined a group practice of OBGYNs, and so I have midwives that help me, and I have partners, and we share hospital coverage call. So I do one 24-hour shift about a week. And so I'm in the hospital and work with the midwife. And I usually have a clinic day, sometimes split in there, and one or two OR days. And so a clinic day, you know, I'm in clinic I choose my start time, 7:30 to my last patient starts at 2:30 or 3. and then I do my charts at the end of the day for that. And I like this so there's pros and cons to this type of life as an OBGYN. It's always interesting. It goes, I'm always doing something different and exciting, which I like. I like going from the OR one day to the clinic next, because clinic can be very draining. Talking to people all day, I think, can be draining. So it's nice to be in the OR. But OR can be draining because of all the stress. So I like going back and forth. Now the downside to that is that my schedule is it changes a lot. My Mondays are never the same. It's just, I rotate call all the time. So that's my life. It depends on what specialty you go into, and you can design it the way you want. So if you are an OBGYN and you just want to do deliveries, you could just be a hospitalist and just work in the hospital all the time as a hospitalist and do 7 shifts a month, 24-hour shifts a month as a hospitalist. So you can design it that way, or you could do mainly clinic 5 days a week, or you can really search for jobs that fit what your passions are. And for me, I like the OR a lot, and I do this unique surgery that not many people do in the country. So I, feel like I need to be in the OR to help these patients get access to this special care. I hope that answers the question, but
Yes, thank you.
yeah, I wanted work. Yeah, I chose this type of group. I didn't want to be in a private practice and on call 24/7. There are practices like that because I wanted to be on when I'm on and off when I'm off, to be able to balance work and family. So.
Perfect, thank you. Someone else asks if you would go through your pre-med journey again if you had the opportunity to, and if not, if there would be anything that you would change about it.
It's a really good question. Yes, I wish I had more fun. I wish I studied less. Yep. I finally got to have a lot more fun senior year when I relaxed a little bit. And I regret I didn't do that sooner in my undergrad journey.
Someone else asks if there are certain misconceptions or myths related to the OBGYN field that you would love to educate others about.
I don't even know. I don't know what a common myth, I guess it's not. Again, it's just like anything else. You make it what you want it to be in medicine. As a physician, you can do that. And, if you, for me, I barely do pap smears anymore. I have nurse practitioners that do that. They do the less complicated visits, and I do the more complicated fertility visits. Or, when women fail medical management, they come to me for surgery. So I get a lot of the complicated cases. So I really like that. I like solving complicated puzzles. So if you don't want to just do pap smears, or there's more to it, and you can subspecialize in a lot of different things, chronic pain or vulvar disorders or menopausal care, or there's subspecialties in OBGYN that you can do, minimally invasive gyne surgery and focus on endometriosis, gynecology, oncology. So there's subspecialties in, once you enter OBGYN, and you can focus on things that you love if you don't like the bread and butter, but some people do.
Perfect, thank you. Someone else is asking what the most important thing you think someone should know before heading into a career of medicine is.
Oh, that's another really good question. You never can really, so especially, well, my guess is if your parents are not in the medical field, you can't really understand or appreciate how much it is. how much it is on you and your family, time-wise, and physically and emotionally, and even spiritually. It is a lot. And so it's really important to do it, obviously, for the right reasons, to do it because you're there to help people. Because if you're doing it for financial reasons, you're going to burn out and be unhappy. But if you're there to help others, it's very uplifting. The money is definitely not worth it. I'm in a ton of debt still. I did a year of fellowship, so 4 years of OB/GYN residency, went into further debt, fellowship, lots more debt, moved off credit cards. And now I'm on just to eat, and we weren't living lavishly. This is just medical education training. You get paid very poorly. And you have no time to go shopping for food. So you can't really save money on your food, for example. You can't bargain hunt. So I'm still almost 4 years out of training, tons of debt. Money is not not great yet because I have tons of loans, but I love what I do, and I work a lot of hours, and yeah, I can get burnt out, but it's a lot, and it's a lot to have people's lives on your hands. So it's important, I think, to have a strong faith as well and support system, and just be strong yourself, because it will challenge you and test you in every aspect. So it's important to be warned about that, not to scare anyone away, but I think it's hard to understand that until you do it. And, you slowly get introduced into the hardship of it. Med school's hard, residency's harder, and it seems to be appropriate for the time that, where you are in life. It's not like you're thrown in. It's really, really hard on day one in med school. It gradually gets harder, but sometimes I'm the only OB/GYN in the hospital. And someone on my watch, could bleed out. That's my job to prevent it. And I don't have anyone to call sometimes. I mean, maybe for backup, but they're not right there. And, I have midwives that I help. It falls on me if something bad happens to a baby or mom. So that's a lot to handle. And that's why you want to, work hard in your training to be the best you can be so that you can give it your all. But sometimes bad things will happen, even out of your control. And that's another really hard thing to handle as a human being. Either you make a mistake, especially in residency, and something bad happens, or, you do everything right and something bad happens, and you still think, what if I had done this? What if I had done this? So it's hard. And we do, just in the medical field period, see such bad things that you do experience PTSD type situations where you may take a month to, reliving something while you heal from it, because of how, the type of scenarios that we get put in.
Awesome, thank you. So our last question for today is if you've experienced burnout, like you were talking about a little bit earlier, and if so, if you have any tips on how to get back on track.
Yes. Yeah. Oh my gosh. Residency, you work 80 to 100 hours a week as an OB/GYN, burnout all the time. You're treated terribly by patients and attending. Not all the time, but often. How to handle it? I mean, it's really hard when you're in residency because you don't take a lot of vacation. But for me, in general, of course, trying to have a vacation or get away, have a hobby, something that you enjoy, even if it's reading or having plants. I love plants. So I have little tropical plants that I kill every once in a while. But on accident, of course, because, when I get busy. But I had kids in residency and med school, and I have a husband. So to me, whatever it is for you, a support system, a good friend, a spouse or children or whatever it is, having a really good support system. Maybe it's your mom there for you, someone you can talk to is going to be the most important thing, I think, because even when I had a really bad day in residency, I'd go home to my kids and I'd be able to get away. The ones that I saw not really ever in residency get over their burnout was people that didn't really have a support system. They had a really hard time leaving work at work, and it's really important to be able to learn the skill of being able to relax and have fun. And even as you need to start practicing that now, even before med school, just as a pre-med student, don't do what I did and become too much of a workaholic, because there is a certain point where you stop, your studying is not effective anymore. And so you need to allocate just time for studying and allocate time for fun and relaxation, no matter what. You need to be able to do that in your life and start practicing now. And self-care, like a hot bath or whatever it is for you. And it took me a long time to realize that. I'm 35, and I finally realized how to do self-care about a year ago. And it's really made a difference, because my health, that high adrenaline state, high cortisol state catches up with you. And I'm finally learning how to take care of myself. So do that now. I wish someone told me that too. That's another regret. So yeah.
Perfect.
Of course.
Thank you so
You're
much for
welcome.
Okay, so I think that's all the time we have for questions today, but thank you so much again for coming to speak to us, even though you've had a very busy day with cases and charting and working at the hospital. What I'm doing right now that I don't think you'll be able to see is that I'm sending out a thank you form in the chat. So once everyone fills that out with some thank you messages for you, I'll send that over to you and you'll be able to read through all of them. But we'll also give you a virtual round of applause on Zoom as well. And we just want to say again, thank you so much for your time and for coming to speak to us. We really hope you have a wonderful rest of your evening. And thank you once again.
Thanks for having me. It seems like a really incredible organization of very motivated students. And, enjoy your life now. And yeah, really thank you for having me. And good luck to all of you.
Awesome. Thank you so much. All right, so with that, we're going to conclude our session for today. If you'd like to stick around, I'll be here to answer any questions that you have. We also have Thanuja here to answer any of your questions. She's one of our executive interns, and we'll just stay around to answer anything that you have. If you want to talk about the research symposium, our next session on Wednesday, again, we're not having a session on Monday. We're giving you all a little bit of a break for the long weekend, is going to be our medical debate. So we're going to be releasing that over the weekend, as well as your week 1 homework. So you can read through that and prepare for the debate next week. We are asking that you at least type in the chat or speak once during the debate if that's something you're comfortable with, but if not, no pressure. And other than that, we're wishing you a very happy long weekend. Please take some time to do things that are relaxing and restful, and we'll see you all later. Goodbye, everyone.